Good morning, good afternoon, everyone. Dr. Larry Earl here with NAOHP Presents, and I'm joined by our special guest today, Dr. Andrew Cedar. Good morning.
Good morning. Nice meeting everyone.
Great to have you here today. Before we get started on effective communication in occupational health, very popular topic, I just want to do a little housekeeping. So if you all could just, some of you are here early. Thank you for showing up early, and give me a little shout in the chat box. Just let me know that you can hear us and see us, or use one of those little emoji icons and say, oh yeah, everything sounds good, just so we know. Thank you. Okay, very good. Got it. Cool. As you know, we have the chat over on the right-hand side, so feel free to enter any questions or comments that you have throughout the presentation. We'll get to them at the appropriate time. And there's also a Q&A section if you want to raise your hand, and if you feel adventurous and you want to come up on screen, you can do that as well. And otherwise, what I would like to do before we start with the formal presentation is I just want to ask a few questions. First of all, I'm going to put them up, and I'm going to put them up on screen. We're talking about communication with employers. Let's see, let me put this one up. Okay, publish. And let's see, is it on screen? Show on stage. Okay, so which situation is most likely to trigger employer dissatisfaction in your practice today? Let me know if that's delay or silence after an injury visit, lack of clarity on work restrictions or status, confusion over what information can be shared. That's one I hear a lot. Over-reliance on portals or reports without direct contact. Or I'm not sure. We usually find out after the fact. You're usually surprised when somebody is not happy with you. So yeah, don't be shy. Come on in, give me your votes. Thank you. Lack of clarity on work status or restrictions. Delay or silence after an injury visit. That's coming in strong. Give you just a few more seconds here. Thanks for chiming in. Who else? All right, so that's interesting. Delay or silence after an injury visit and lack of clarity on work status or restrictions are the big ones. And I actually hear a lot confusion over what information can be shared. That didn't come in quite as strong. So, all right, thanks for that one. All right, I'm going to close that one down. Another question for you is, okay, let me put this on the stage. For occupational health services, who does your team primarily think of as the client? Is it the injured employee? Is it HR, safety or risk management, operations and supervisors, or it depends on the situation, or you don't know? Who's the actual client here? Who's the client? Injured employee. Interesting. And injured employee and safety and risk management are coming in strong. A couple of HRs. Who else is going to let us know here? Okay, so injured employee and safety risk management. So we will address that during the presentation. Thank you very much. Interesting. And then I got one more, and then we'll get started. Let's see. Oh, no, we did that one already. Satisfaction must be, okay, here we go. I found it. Here we go. All right, and last question. What communication method does your clinic rely on most for employer updates? EMR portal or dashboards, email, faxing, phone calls, or a mix, but maybe not consistent? Phone calls, EMR portal dashboards, email, faxing is falling out of favor, perhaps. Kind of mixed, kind of a mixed bag here, huh? All right. Interesting. Thank you for participating in that. All right. So that's kind of a mixed bag, that one. Interesting. All right, I'm going to close that one down. And thank you for waking up and participating in that. It's always nice to have a little audience participation. With that, I am going to turn it over to Dr. Andrew Cedar, and he will give his own little introduction in his presentation. And I've got a few slides on that. So take it away, Dr. Cedar.
Thank you, Larry. Let me just pull up my presentation, if I may. And this may take...
And I'll be monitoring the chat. If you guys have questions or comments, I'll either answer you in chat or we'll bring it up during the session. And of course, there will be time for questions at the end.
Larry, can you see my slides?
Yeah, we got it.
Okay, great. And first of all, thank you, Larry, for the invitation to present. And thank you for everyone in the audience for attending. And what Larry asked me to talk about was really how communication is such a central component of an effective occupational medicine practice. And I want to talk about a variety of issues related to that communication process. So a little bit of a background. I'm a physician. I'm board certified in internal and occupational medicine. I practiced OCMED almost exclusively for 30 plus years. I operated 2 independent occupational medicine businesses that served corporate clients throughout the Metro Milwaukee and Southeastern Wisconsin region. And those businesses comprised 4 standalone urgent care clinics, 20 on-site clinics, about 80 employees. And we served, when we were, had a mature program, over 500 different corporate clients on an annual basis. And we would touch base intermittently with even more than that, for an isolated service, like a DOT, excuse me, or a drug test or MRO services. So I think fair to say we developed a fairly robust program. So with that background, I always say, I feel your pain. I know what it is that you guys have gone through because my organization and myself did so as well. Just a personal disclaimer, when I was practicing OCMED, I've currently retired from clinical practice. I was always a bit frustrated by the EMRs that were available, and I went ahead and built the Sensia Tech Occupational Medicine Portal software. And really, in building that, really focused on the need for communication, and I'm going to talk about that in general. And I met Larry by being a vendor at a couple of his conferences. In following Larry's material, I think fair to say that the NAOHP agenda for 2026 is that essentially successful occupational medicine practices are ones that are organized. Success does not occur by accident. Success is really something you have to plan for. You have to have structured services. You have to hold your staff accountable. And a key component of this, of providing this service in occupational medicine, is that you have to hardwire client communication. In our organization, back in the day, we did this mostly through phone calls, but times have really changed. The technology has advanced significantly. So there are other, even more effective ways to communicate with your clients on a regular basis and build it into your system. Now, I think it was interesting to see the responses to Larry's questionnaire about who is your client. And in my experience, I always felt that ultimately it was the employer that was our client in an occupational medicine practice. It was through that employer relationship that we would ultimately see employee referrals, that would be able to do the drug testing, post-offer physicals, whatever service it was that that client ultimately would require. They could view us as being their resource, a reliable provider, and that's how we developed those relationships. Now, the challenge in all of that is we realize quite well that we're walking a tightrope at times. And even though it's the employer that's our client and we want to satisfy their needs, ultimately we are interacting with and treating an employee. So I always felt it was important, and I stress this with my providers, that we always wanted to provide quality medical care first and foremost. And I felt that by having that understanding that it was the employer that's our client, but we need to provide this quality service, we could kind of reach that nice balance and not sell our soul to the employer to meet their needs. And in fact, there were times, and Larry will attest to this, that we would occasionally have to fire a client because they'd be asking us to do something that we weren't comfortable with as an organization. So, I always felt that this is my practice, this is my medical license. I'm not going to let any corporate client ask me to do anything that's going to put any of that in jeopardy. And our standard mantra in our business was just do the right thing. So I always told my medical providers, if you feel you need to prescribe a medication or take someone off of work, and this is going to become OSHA recordable, we just have to do it. And but as long as we have that open communication and good relationship with the client, we can discuss that and get through those cases. And to some extent, actually earn a degree of credibility by so doing. Because if not, then you kind of get run over by your client. And you want to be very careful about that. But what I found is, well, the corporate clients, really what they wanted more than anything else is they wanted to be heard. They wanted, to have a voice in the conversation.
Hey, Andy, we lost your slide. Sorry to interrupt. We lost your slides.
Oh, really?
Yeah, can you reshare?
Let me just go back in here. Sorry. Minimize this. Get back into our presentation here and share again.
There you go. Now we've got your screen. Now we want your slides. When you switch over, we should see them. Yep, got it. Just blow them back up again in presentation mode and we should be good.
Got it. Thank you. From the current slide. Okay.
Yeah, there we go. Okay. Yep, got it now. Thanks.
So ultimately, once again, your client wants to be heard. And this is why this is so important, the whole aspect of communication and sharing information with your client. So we established kind of a routine practice, which I'll go into a little bit, of how we shared that information. Now realize that even though you want to hardwire this into your system and have these routine communication channels, you're also going to have specialized needs for every one of your clients, and you're going to need to personalize your service and your delivery to each of those clients. And many times the individual we're talking to at the place of employment, is under scrutiny within their own organization regarding their hiring. We want to get people hired in a timely basis. We want to manage our work injuries. So they're answering to a higher source. They need to impress their bosses. They need to know what's going on. Now, the audience obviously changes based on your client. So with some of our clients, the human resource director was the primary person. They wore multiple hats. Other clients that were larger in size had their own dedicated safety directors and work comp safety teams. We had on-site medical clinics, which I'm going to talk about a little bit later. And oftentimes it was the plant manager that was our primary point of contact with those organizations. And we even had some clients in which we were interacting directly with the business owner. So I think fair to say, when you look at each of these positions, each of these individuals is going to be looking for something different from a communication point of view. The HR director is probably going to want the drug test result, the post-offer physical. They're going to want it on a timely basis. The safety director is going to want to see the return to work recommendations, ideally the medical notes. The plan manager, little less concerned about getting all that data as long as they know that things are being managed and progressing in the right way. And the business owners could be kind of all over the place based on their personalities. We had some pretty interesting business owners that we dealt with. Now, I want to pause on this screen for a little bit, because what I want to challenge all of you to think of is communication actually has multiple tiers. Because basically what you're doing when you are communicating with an employer is you are sharing information. So if you think about it in terms of standard reporting, what is it that your organization should be reporting to a client on a regular basis? I think fair to say that standard reporting would be drug test results, post-offer physicals, work injury treatment. And those are really kind of the three main aspects. Larry, am I missing out on anything, in terms of that information that should be shared regularly?
Yeah, those are your core services. I think that everybody in Occ Health pretty much performs.
Right.
So yeah, those would be the three areas.
And we'll discuss each of those in just a bit.
Okay.
But are you able, as an organization, to share statistics with your clients? In other words, if an HR director with one of your companies said, could you provide to me how many drug tests we did with your organization in 2025? And what were the results of those drug tests? Would that be a result that you could come up with readily? Or would you have to take some time to generate those statistics? Would your EMR be able to allow you to do it? Would you have to do it through the billing staff? So that's kind of the next tier of reporting. Can we provide these statistics on a ready basis? How many work injuries did we see in 2025? What was the average time off work? So those are the basic work comp information that clients may be looking for. Another one, which we're also going to talk about, which I found to be a significant information that we could provide for our corporate clients, is could we demonstrate value for our services? What was our return on investment? And those reports or tests we were predominantly able to generate when we had on-site medical staffing. Now, I appreciate that I'm talking to a group of providers and individuals from a variety of different organizations, and I'm not sure how many of you have considered or provide on-site medical staffing. But if you think about it from a communication and a client relationship point of view, that on-site staffing is almost the ideal. It's supreme. When we had our medical staffs on site with a regular basis, we would meet with the corporate clients practically weekly. They would have a good feel for what was going on because we were interacting with them on such a regular basis. And out of those on-site staffing arrangements, we were able to demonstrate these return on investment reports. I'll show you that a little bit later. And really the core purpose for doing all of this communication, and what I'm asking you to consider, is challenging yourself to advance up the hierarchy of what your organization can provide your clients, is that ultimately this is how you build and maintain relationships. And it's through that relationship that really your business is going to thrive, that you're going to be able to maintain and even grow your revenue stream. And there's one more thing I would say before we leave this slide, and that is, what is your competitor doing? What are they doing? Are they providing this information? Because if they are, then certainly you have to up your game. If they're not, here's an opportunity for you to exceed the services being provided by your competitors. And with technology advancing and changing so significantly, especially in the AI world, and I learned this through the development of the SensiaTech EMR, we can create and we can collect and create and provide these statistics. So this is going to become more of a norm and something that your organization will need to consider in terms of how you advance. So if we
So
can
some
talk
folks
about,
are chiming in on the poll, Angie, we just put it up, getting some votes for standard reporting and demonstrating value ROI through reports. Just checking to see who is performing those services that you have up there. And yeah, interesting. On-site staffing is right up there. So a lot of folks are taking advantage of that opportunity and providing a great service for clients that way as well.
so Larry, I'm sorry, I can't see the result, but so
Yeah.
you're saying fair number of the attendees have on-site medical staffing services.
Yeah, almost a third of those responding. So standard reporting is at 35%, summary stats 22, demonstrating value 13%, on-site staffing 29% of votes counted. Thank you for chiming in, everyone. Appreciate that.
Right. So what I might challenge the attendees is, why don't you get to doing all of it? Now, I can appreciate on-site staffing might be a separate business decision, but what can you do to progress your organization, to advance your organization, so you're providing this regular reporting with statistics and you can demonstrate value?
Yeah.
Those are really tremendous services that you can provide your corporate clients, and will really endear you to them and help to build those relationships.
Those are the differentiators between
Exactly.
my famous Joe Blow urgent care down the street.
Exactly.
Yeah.
You know, and that we will really differentiate you as being a true ACMED provider. Now, when to communicate this information, and this really relates more to the kind of standard reporting that I've put at the top of the list here. And what our organization did is we would contact the employer after every drug test and every post-offer exam. Now, back in the day when we were operating our clinics, that was done mostly through phone calls. We were generally successful in getting through to people or could leave a message, and we know that message would be received and eventually heard. That might not be the case today. We're going to get to that in a bit. We always contacted a client whenever we had an initial injury treatment. And many times, based on the client, we would contact them after every patient visit. Now, that might be a little bit extreme. And one of the ways to kind of differentiate from that, or maybe to cut back on that demand, is that you at least contact the client, or have your medical providers contact the client if there's any significant change in the medical status or the return to work status of a case, whether it either be good or bad. If the case is improving, take credit for it, let your client know. If it's worsening, you want your client to hear about it from you and not through the employer or through the grapevine. Certainly upon any discharge from care, when their care has been completed, you're going to want to turn around and finalize and close that case. Take a pat on your back for so doing. If the client ever requests it, and we had certain clients that wanted to know what was going on specifically with individuals, kind of their more problem employees, they would want to get that feedback, and we would follow through on that on a regular basis. Also, one of the things that I stress to any of my providers is that if you sensed any concern on the behalf of a client regarding anything that has to do with that individual or employee's treatment, let our sales and marketing staff know, let myself know, because we would use that as an opportunity then to reach out to that client and potentially even set up a meeting with them so that that concern would not linger. Because ultimately, that's how you're going to lose the employer confidence and maybe even lose the employer's business. And we also tended to communicate more when we had a new client, just to make them feel comfortable with the level of service. Now, how to communicate? And I think fair to say this is all going to significantly change as we move forward. As I mentioned, there was a time where we predominantly would contact clients with a phone call. But I think fair to say making a phone call and getting through a phone blocker, leaving a message, is more difficult. I know I have a phone blocker on my phone. I get a lot of inadvertent or I get a lot of phone calls from sources I don't want to hear from. So I'm blocking them. So if one of your medical assistants calls from a back office number to the HR director of one of your corporate clients, that phone call may not make it through at all. It's also a bit time intensive to do it through phone calls, although we want to do so as much as possible on the standard reporting side. Fax, I'm not sure how much people are using fax. The question comes up is fax HIPAA compliant? you would need to be careful about that, because I think fair to say everybody knows that not only the medical providers, but the corporate clients need to be HIPAA compliant as well. We're all held to that same standard. And will that fax be received in a secure location wherein nobody else will have access to that paperwork? If someone else is walking by a fax and sees something they shouldn't see, you've just committed a HIPAA violation. Email, probably very common, but I would ask you, do you have encrypted email on both ends? In other words, are you able to send that email in an encrypted format? And is the client able to open it on their end? We utilize encrypted email, but what I find is that the recipient needs to be a little bit aware of the technology so that they know how to open that encrypted email. And for any of you that are still relying on paperwork, I would strongly encourage you to end that practice. Really, in this day and age, security is so important that really you need to look at what will it take to transition into a fully electronic system. And oftentimes that paperwork gets conveniently lost by the employee. So at least these are the main points I'd want you to consider when you're looking at communicating or sharing information with your client through any one of these approaches. Where I feel that the future lies is having EMR portal access. And it sounds like a number of you are already using that portal access through your EMR to share that data. And part of the reason why this is so beneficial is it's very secure. So when you assign an administrator access into your software and they're seeing their results, they're basically doing so within that technology bubble that you're providing through the EMR. So in that case, you're really not emailing data, they're simply accessing the data that's already in the system. All of that information is encrypted until opened and received, so it ensures a secure arrangement. The EMR portals hopefully have access to or provide dashboards, and those dashboards should be arranged in a manner wherein the human resource director would be granted access to the HR dashboard, where they could see the results of their post-offer physicals and drug screens in real time as they were occurring. The employee safety director can see the results of the work injuries, the return to work forms in real time as they occur. The employee health department can see all of the medical surveillance activities, audiograms, respirator clearance, your whole vaccination campaign, once again, directly through their portal in real time. So if you do have these reporting dashboards available through your EMR portal, it's very secure. It shares information. It also allows you to create those summary reports very easily. Gosh, I'm blanking on the third point I had in all of this, but it just proves that the dashboards work very smoothly. They're a good thing to have. Hopefully your EMRs offer this sort of service. And with the advancement of AI into healthcare technology, I think fair to say these dashboards are going to be viewed as more of a requirement of the EMRs than necessarily as a nice add-on. Also, with your corporate clients, you can designate the client administrators who would have access to each of these dashboards. So even though in your organization you can see the results for every client, the designated client administrators obviously should only see the results as it pertains to their specific information or their specific client. I want to stress again, this provides for you cloud-based security, but there's no doubt as we rely more on technology, we have to make sure that we're not becoming impersonal in providing that service. So as much as possible, even though your organization may provide EMR portal access, we want to make phone calls on a regular basis, even if we're leaving a message. But we still want to have that personal touch with all of our corporate clients. That's how we maintain that business relationship. So just to give you a quick snapshot, these are the dashboards and sort of how we've arranged them to kind of speak towards how these services can be and should be provided to your corporate clients in that secure, real-time arrangement. Now, one of the questions that came up was, what sort of data are we allowed to share? And I think fair to say we can always share results without necessarily sharing personal health information. So we can say a drug test was negative, or a drug test was non-negative, or the individual is their post-op physical, they were cleared without restrictions, or they're cleared with restrictions of X and X, without necessarily having to share all the personal information that went behind that decision in making that report. And ultimately, your corporate client, all they're really looking for is that data, is that placement information. Now, the work comp side is a little bit different. With a work-related injury, this is actually considered a HIPAA exclusion. So per HIPAA, your organization can share medical information. You can share that medical note with the corporate client. Now, you don't want to share the entire note because there's probably information in that note that is unnecessary, or would be a violation of HIPAA. If, let's say, you were to share something about their individual social history or family history, that's not really germane to their work comp case. So, are you able to offer and provide a redacted note? Now, Larry and I were kind of reviewing this note, and in our system, you can manually remove any data from the note. So even though in this case, you're seeing the patient has a history of left ankle fracture and surgery, you can manually remove that if you feel that that's information that wouldn't be germane to that redacted note. But think about it. It would be very nice for your organization, when you see a work-related injury, to be able to provide a redacted note to the employee safety director every time you see one of their employees. Now, I mentioned previously that another layer of kind of progression in terms of communication is, can you demonstrate value? And in our organization, as you recall, we had 20 on-site medical clinics. And with each of those, I really wanted to demonstrate the value that those on-site clinics provided to our corporate clients. And I took it under my wing to create these semi-annual clinic utilization and return on investment reports. And what I found is that they were literally a game changer. First of all, they were very educational and instructional to me as the business leader providing this service, to see if we were actually providing something of value, which we were. And then by providing these reports specifically to the corporate client, we were really able to solidify our presence in our relationships with them. So we were able to provide all applicable statistics. How many people did we see? We didn't necessarily say what they were seen for, but part of what we did was we assigned a value to each one of those visits. So even though we had an on-site medical presence and we were not billing the insurance carrier for our services, we were billing just a straight hourly rate to do so, we still took value for what we saved by that individual not going to an outside clinic or going to an urgent care or going to an emergency room. So even in those cases where we were seeing patients to an on-site location, we would assign an ICD-10 and CPT code, even though no insurance claim was generated, we wanted to make sure we accounted for the value we were providing to that client by having that service through the on-site facility. Also, if we were doing post-offer physicals on site or drug tests on site or vaccinations on site, we wanted to make sure we had an accounting of all of that value as well. But where we particularly saved clients a lot of money was on their work comp cases. So instead of these cases going off to an urgent care or emergency room, we would literally have work comp cases which were seen in the on-site clinic, treated and completely resolved without ever generating a work comp bill. So that's really an amazing value to be able to provide. And if you can see over here on the slide on the right, total estimated cost savings. In this case, we saved this client almost $500,000 a year. We had one client, we saved them $2 million a year in overall expenses. And you can see here also the staffing charge for this was about $140,000. So not only did we demonstrate significant value to our clients, this was a great revenue generator that was occurring on a regular basis. Now, I have to admit that creating these reports was challenging. And part of the reason I pursued the whole EMR, ACMED EMR pursuit was to be able to create these reports, with a couple of keystrokes. Now, for those of you who don't do on-site medical staffing, and once again, I bring this up because I feel this is kind of the pinnacle of communication and information sharing with a corporate client, is since you are right on site, you are interacting with that client practically on a regular basis, practically on a daily basis. The way our model worked, now I know there are big organizations that will come in, build out a $300,000 entire urgent care facility. That wasn't the case with us. Our standard client was about 250 employees, ranging anywhere from 50 employees to 2,500 employees, somewhere in that range. We weren't shooting for the big 10,000 employee clients. There were plenty of clients that were in that middle range that gave us a great opportunity to have a successful business. So with those clients, all we really asked of them was that they provide for us a moderate sized office, 10 by 12 office, preferably with running water. The corporate client would provide this to us free of charge. We would bill them for about $5,000 in medical supplies. So essentially we had no financial investment. We didn't need to spend any money to start one of these on-site clinics. I would hire the staff. Many of them were part-time because a lot of times our on-site clinics were just 8 or 12 hours a week. They didn't need to be full-time. We had one client, we were on-site full-time, first, second, and third shift, Monday through Friday. So for every client, it's going to be based on what their specific needs are. The technology needs are not that significant. Obviously, that service model varies based on the size of the client and what they're looking for specifically. But the big point I want to stress out of this was that we could rely on this recurrent monthly revenue stream. And of those 20 on-site clients, we never lost one. They all loved it. And I think if we had continued to go along with the business, it would have been something that would have steadily grown from there. Now, when I say here hardwire face-to-face interaction, I've stressed to this point that we really want to be able to share that data electronically with our clients on a regular basis. But we don't want to become so reliant on that electronic communication that we lose the ability to meet with and talk to our clients on a regular basis. So that's why we still want to make sure that we're meeting with our clients personally, face-to-face. I know one of the things that I did, I was always interested in this, to know what our corporate clients did. I would personally visit each of their facilities. And many times I was the only physician who ever had or ever will walk through any of one of these corporate clients or corporate facilities, really, but it's amazing to see how they work. And oftentimes, as we would have an extended relationship with a client, I would have my other medical providers go out and visit as well. So we kind of had a regular steady stream of visiting with that client having the medical providers. And also, no doubt, it's better for the medical providers to know exactly what is going on with these corporate clients instead of just hearing it from the employee. We would schedule face-to-face meetings, like I said, with these return on investment or utilization report meetings. Those would be every 6 months. But when we had our on-site clinics, oftentimes those were weekly conferences. I would find opportunities to just reach out and give clients a phone call, whether it was really necessary or not. But it was always just a great way to continue to touch base and build on and strengthen those corporate relationships. Now that kind of leads me full circle back to where we started. And that was kind of revisiting NAOHP's agenda and focus for 2026. So even though, once again, and this is my opinion, the employer is the client, we always want to make employee health, and the medical services we provide to each employee, the primary focus. You still want to be known first and foremost for providing quality medical care, but you need to find that nice balance where you can walk that tightrope and also keep that employer satisfied. Provide an honest opinion. What I've really talked about, over the last 40 minutes or so is find and develop and implement a strategy where you can report your information, your communication on a regular basis to each of those corporate clients. And I challenge each of you to look at that list of how we can become more sophisticated in the information that we're providing to each of these clients, because that's going to improve that long-term relationship, and it's going to keep you ahead of your competitors. A couple other things, just respond to requests promptly. One of the advantages we had of being an independent organization was that we didn't have the bureaucracy of a big system to go through. We could literally discuss new services and implement them relatively quickly, sometimes within the matter of just days. So with that in mind, I'd like to bring my presentation to a close and ask for any questions. Thank you.
Thank you, Dr. Cedar. Wonderful. Yeah, reiterating quite a bit of some of the concepts that we've been talking about here at NAOHP for a very long time. Actually, I have a couple of questions, and I don't see any in the chat just yet, but please feel free to fill in your questions there or raise your hand through the Q&A and come on up. Andy, in terms of demonstrating value and return on investment, I know you showed some kind of impressive numbers there on total ROI, but what are the sort of specific metrics that you're focusing on to show employers this is how we improve your business and the value that we provide?
Sure. Well, one of the ones obviously was work comp expense. So one of the bits of information or piece of information that I would need to ask the corporate client to provide to me was, what was your total work comp expenses for a period of time? So if I'm developing that return on investment report at the end of the year, what were your work comp expenses for 2025, as an example? What were they in 2024? What were they in 2023? So that when we started our on-site presence, we wanted to be able to demonstrate that we were able to manage and reduce those overall expenses from year to year. Now, there could always be an outlier. You could be doing fine. The client could have one significant work injury that would, spike, that would be treating in an outside facility that we had no relationship with. So you'd want to be careful how, that was included or potentially excluded from the data as it relate to the return on investment through the on-site clinic. And like I said, we had one client that had runaway workers' comp because no one was really scrutinizing the cases. So even by having that on-site clinic, we were evaluating those cases to see if they were even work-related to begin with. And by so doing, by establishing that assessment, the number of work comp cases significantly went down. The number of people who were claiming work comp injuries significantly went down. And it's not that we were denying real claims. We were just putting in a process to evaluate those claims appropriately. Also, by having the on-site clinic, just the return to work was really promoted. So the work comp was first and foremost. We would also see people for a number of other private issues. So what would this cost if you went off to an emergency room or urgent care? And I would ask all of the attendees to look at, to go in and look at what the healthcare costs are in their community for work comp or urgent care. As it has so happened to be, Milwaukee is one of the most expensive medical markets in the United States.
Yeah.
Okay. To go into an urgent care or an emergency room, it's not uncommon to get $1,000 bill plus for evaluation of a sore throat. Obviously, we could take care of that through the on-site clinic, and we would take an accounting for that value that we were providing. Now, I never put in $1,000. I just put in 150, something realistic. So I feel that we were even undervaluing the return on investment and the valuation that we provide. And then the last one, Larry, is just all of the on-site post-op physicals, drug screens, audiograms, respirator clearance that you're no longer doing through the on-site clinic. Now, the nearby clinic. Now, someone might say, well, we're pulling money out of our own pocket by having the on-site providers.
Right.
Having the on-site providers was just a great revenue source. It was great, and you're billing the employer directly for that service. So if our bill was $30,000, we bill $30,000, we get paid $30,000.
Yeah, very good. Alex asks, do you feel you could ever be in danger of over communicating, such as with portal, fax, phone call, email? Are they getting everything all at once, all the time?
Well, I guess that's always a possibility, but I would just ask you, to be in contact with your client. If they say, I'm getting too much, I really don't need this, then you can scale back your practices, because part of what, I said earlier on was you really need to personalize this service.
Yeah.
Now, part of the benefit of a dashboard, though, is the dashboard is just sitting there. So when that post-op physical or drug screen is done, the results go straight into the dashboard. The human resource director can decide when they want to access that dashboard and see the results. Now in our EMR, we can actually ding that employee to let them know there's a new entry in there. And if they're sufficient getting the dashboard and don't want to get the phone call, perhaps that's how you want to modify your practice with that specific client. But we typically found people wanted more than less.
Sometimes you can do that on the employer profile if you're setting it up. What are the preferences for communication? Right. Do I want, have check boxes? I want an email, or I want a phone call, or I want, what are the preferred methods? So that's right. Another way to do it. Trina wants to know, we're seeing a decline in pre-employment physicals and an increase in essential functions testing. How do we show the benefit of still doing the medical physical?
Well, if I may, I believe by doing the essential functions physical, you're basically doing a post-op physical with a little bit of a different twist.
It's a POET, right?
Right.
OPA.
Right, because basically what the ADA says is you're evaluating someone to see if they can safely perform the essential functions of the task, with all of the other caveats that go with the ADA. So it's just kind of a better, if you think about it, it's almost a more appropriate approach to an evaluation for a post-op physical, instead of just relying on someone's medical history, but really looking at, can they, do they have a medical condition or a physical condition that would really affect their ability to perform those essential functions. So I don't know if that necessarily changes the value that you're providing. You might just be labeling it in a different manner.
Yeah, I think the service is the post-offer employment evaluation or test, whatever you want. Some people call it POET, some people call it POPA.
Right.
post-offer placement assessment. It has many different names, but I think that the concept is, as you said, can this individual meet the essential functions of the job according to the ADA? That's what really the evaluation is for. So do they need a complete physical exam? No, not always. Sometimes they just need an immunization review. Let's say if it's a nursing job, right, in the hospital, you need an immunization review. Can they lift 30 pounds? And, you know, do they pass their drug screen?
Right.
So I think it really goes to the job demands analysis. If you're doing those, what are the essential functions of that job? You either have a functional job description, or you've gone out and you've done a JDA, a job demands analysis. We presented on that recently. And then the result of that is now you develop the POET to be compliant with those job demands. And that's the pre-placement exam you offer to the client.
Let me offer another perspective on this. With the on-site medical staffing, with one of our clients, when they hired a new employee, we actually had them go through a transition period into their normal job. So they were monitored on a regular basis just to make sure they weren't developing any bad habits or were starting to develop physical symptoms that might lead into an injury. Because oftentimes you'll see a spike with injuries in those who are in their first year of employment. And as they get more customized to it, it will start to steady out. So we tended to have a little bit more focus on new hires. And the post-offer exam was not only a post-offer exam, it was a whole post-offer process. It was a whole onboarding process that went along with that new job.
Yeah, thanks for that.
Because
Trina also wants to, sorry, go ahead.
we could do it because we had the staff there to do it.
Yeah. Andy, you can unshare your screen. We're just getting the infinity screen here. Trina also wants to know, what are your thoughts on a blended on-site clinic, OCMED and primary care? And oftentimes that question is OCMED and urgent care. And before Dr. Cedar answers, I'll just let you know, I've been asked this multiple times recently, and there is a post coming out. Watch the newsletter. There will be a post coming out shortly on that topic from me. But go ahead, Angie.
So the thought about having a combined OCMED and primary care clinic, okay?
Yeah.
Well, it just sort of naturally happens, because even though we have the on-site providers there for work comp reasons, they would inevitably get asked to see people for a cough or a cold or a sprain. And so that was another beautiful aspect of that service, is that you could kind of progress it into other offerings. So it kind of naturally happened. Although we always tried to maintain the fact that we were there first and foremost for OCMED reasons. Now, we had one client that wanted us to see if we could see family members, okay? There are a couple challenges with that. Are all your providers going to be able to train to see people from birth to, no. I know as an internist, if you're younger than 18, I don't know what the heck's going on, right? I perhaps shouldn't quite say it that way, but I'm not a pediatrician. I'm not going to be able to see children. And so it's going to be challenging to find medical staff that are going to be able to provide that broad spectrum of service. Unless you have a big client that wants, that the big build out and provide all those services. Under that scenario, you might be able to, you might want to hire, and I'm sure that would be a very lucrative practice to be able to offer. And the second one was access to the clinic. A lot of times our clinics were actually on the shop floor, just off the shop floor. So you don't want family members to be walking through a production facility to get to a medical clinic. But you want that medical clinic to be accessible to the employees. So I'm not saying it can't be done. It is just another level in terms of what the provision of service is going to be. And then I would come back to, what's your business model? Okay. Stick to what it is that you know and do well. You can extend it, but just make sure that by doing so, you're aware of all the ramifications that are going to come out of it.
We're coming to the top of the hour. We're trying to keep it just right at the hour. There's a couple more questions, so let me get through the next ones. What is your experience with having formal consulting agreements for employers for occupational health services? Formal consulting agreements.
Can you define that a little bit for me? What do you mean by formal consulting?
I think they mean like a signed contract. So my answer is we always had a medical services agreement, which was not exclusive, but it basically just outlined what services we would be providing. Sometimes we had a fee schedule along with it, what our expectations were in terms of the communication, how we're going to bill you, our financial policy, that kind of stuff. It's more like an acknowledgement of what services are being provided at, and sometimes what pricing, versus a formal contract. In my mind, that's how we approached it. We called it a medical services agreement. If you want our standard NAOHP version of that, just email me and I'll give you a copy of our template for that.
What's the scope of service? Right?
What's that?
What's the scope of service?
Yeah.
And we define that as well in our relationship with our client. This is what we would do, and this is what we would not do. And it's defining the not do that's just as important as what it is we can do.
Yeah. So I put my email on the bottom. I'm sure you have multiple inboxes from me. If you want a copy of that, just let me know. Do you have a good RACI, responsibility assignment matrix, swim lane on what your employees essentially do daily to keep the employer satisfied? Good question. Like, who's responsible for what in getting information to employers?
Well, we had that somewhat, we had that informally and formally defined. I mean, formally, we knew what we wanted to communicate and who was going to do it. Did we necessarily have it in a written practice back in the day? No. Is it more appropriate to do that this day? I guess. And I wouldn't say guess, I'd say yes. I would encourage it to have that. And a lot of times, the provider who saw the patient would be the one who would make the call. Okay? Because they're the ones who are going to be able to answer the questions. The medical assistants would call in on the drug tests and post-op exams, those sorts of things. So that was kind of our relatively clean delineation between provider groups as to who was responsible for what.
Yeah, there's a bunch more stuff on employer communication that I put in the last newsletter, both in the Occupational platform. There's some stuff there. There's a little mini book that I wrote that has answers to some of these in there as well. So check the last newsletter, and you'll find more information there as well. Is there a name for the post-offer process? And we're coming right at the top of the hour, so if any of you have to go, that's fine. We're going to stay on for a few more minutes and just answer questions. So thanks for all the questions. Is there a name for the post-offer process that you were explaining before?
You know, we've used this as always kind of falling under the general umbrella of fitness for duty. So fitness for duty applies to a post-offer exam. It applies to a return to work exam. You know, if you're coming back from work for non-work related reasons, that's a fitness for duty exam, right? So fitness for duty is a broad term, which really encompasses what we spoke about earlier. Can the individual perform the essential functions of the job without creating a direct safety risk to themselves or the other? Those are kind of your standards. You can use those as your guideposts to make those exams. And if you think about it, everything I just mentioned basically comes back to those two pillars. Fitness for duty.
Yeah. And then, or something more to read up more about it. Yeah, TJ, I have some stuff I'll get over to you on job demand analysis, post-offer testing. I know we spoke about this in the CWIMP course a little bit, but I have some more stuff on that. I'll get it to you.
And the ADA is fairly explicit on what you can do and how you can do it. the ADA is much more empowering to the medical providers than they realize.
Yeah. Can you share the slides? Yeah, we'll post the slides along with the video in the Occupational platform. So yes, it will be in there. That's the meaning I had in mind, Dr. Earl. Okay, thanks, Christina. All right, TJ, thank you. I think that's everything. So wow, great questions. Thank you so much.
And I'd be
Yeah.
happy to talk to anyone if they have any questions for me, or I'm available as well.
Yeah, and of course, thank you to Dr. Cedar and Sensiotech. Great technology. We'll be certainly communicating with everyone more about, if you want to see more about the Sensiotech EHR as well. Great platform, and thank you for sponsoring today's presentation and presenting today's presentation. Thank you very much. All right, well, with that, we'll end it there. Thank you all for showing up and participating with your questions. And watch your email for follow-up information. Thanks again.
Bye now.